So much for prescription drug prices going down because Tangerine Menace has just announced 100% tariffs on imported brand name medications. Yep, you heard that right. 100% tariffs on medications unless that company is building a facility here in the United States and actively manufacturing. I just want you to know people are going to lose their lives over this because they're not going to be able to afford the medication they need to save their lives. And we, the United States, import medications, brand name medications from countries like Australia, the EU, India. And by the way, the EU was the first to say, hey, remember that trade deal we made with you? We capped tariffs on prescriptions. But apparently, Trumpelstiltskin doesn't really care about that. No, not at all. So much for his campaign promise of lowering drug prices, because now Americans are going to have to face the decision, do I put food on the table? Do I pay my mortgage? Or do I take the medication I need to live a good life or to stay alive? And this is starting October 1st.
Hey beautiful people, welcome back to my YouTube channel. Thank you for stopping by. So all credit goes to the creators in this video. So guys, in today's video, honestly, when I heard about this Trump introducing 100% tariff on imported, branded and patented drugs, I had to pause and think, because I don't know what you think guys, but that is really huge. Because the way these companies can avoid it is if they are actively building a plant in the United States. And how many of them? Basically, I feel that Trump is trying to companies to make their drugs or their medications rather in the United States. And looking at the logic, America relies a lot on foreign medication, especially from countries like China and India, right? So if those companies start building their factories in the United States, it might create job, strengthen the supply chain, make the US less dependent on imports for essential medicine. But guys, looking at the bigger picture here, here's the catch. Not every company can move or expand so quickly, because bigger players, right, they are probably fine. They have the funds and they are probably already invested in US facilities. But smaller companies might struggle. It's not even might, they will struggle, because imported drugs will now become more expensive before these new factories are even built. And it will hit the consumers in the wallet, especially those that rely on branded medications. And let's not forget about trade. Countries like India and Ireland that are major suppliers, it will definitely strain the international relationship, or even cause a trade retaliation or trade war or whatever it is. Guys, this looks like it's a bold move, but it's also very risky. Let me know your thoughts in the comments. Let's see what these other creators have to say, and I'll see you soon.
Everybody should be really concerned about this. So our healthcare system cannot handle this. There are a lot of people out there who are already struggling to afford their medication. Forcing pharmaceutical companies to build plants in the US will likely increase the cost of the drug because they are putting in a bunch of investment, because that's how business works. So because of this, the drug is still going to be more expensive, whether it is the tariff or whether it is the new cost of the drug since they had to build a plant here. We all need to be making a fuss out of this. And I know a lot of people are going to say, we need manufacturing jobs, we need these jobs in this country. Can we please think about the impact this is going to have on our healthcare system, on people who depend on medications that are not made in the US? Spread the word, make sure we're talking about this. Call your representatives, call your senators, and ensure that they know that this is unacceptable. The American people cannot afford increasing costs. This is going to negatively impact our healthcare system. It is going to be terrible for this country.
Trump has announced that there's going to be 100% tariffs on prescription medications that are made internationally. And I've got news for everyone who is celebrating this. Almost all of our pharmaceuticals are made internationally because that's where the plants are. That's where the manufacturing is. And you can encourage companies to relocate their manufacturing all you want, but the fact of the matter is that takes years, sometimes decades, to relocate. So that medication that you need might now no longer cost $100, it will cost $200. And I don't know about you, but I don't think a lot of people are choosing the pharmaceuticals that they're taking. These are things that are saving our lives or drastically improving the quality of our lives to the point where we need them. So I don't understand how punishing U.S. consumers, sick individuals, or people who need prescription medications helps incentivize anything besides lining the pockets of Trump and his cronies. Because you are the one paying those tariffs, not the companies where they're coming from. So it might be an import tariff on China, but you're the one paying that. And your bills are going up.
Guys, let me know your thoughts in the comment section, because when I think about this tariffs more, it's clear that it's not as simple as it sounds, right? Because this rule about actively building sounds somehow. Does it mean that the companies that have started building, does it mean signing contracts? Does it mean pouring of the concrete? Because companies and government agencies might interpret this actively building differently. And I feel it might just lead to conclusion. And there's the global impact also. Because countries like India, like China, like Ireland, those countries export a lot of medication to the United States. And let's say even if generics are spared, right, branded medications can face higher tariffs. And this will just raise the medication prices for patients, it will slow down shipments, and it will even cause companies to delay innovation because, okay, let's say they are focused on building US plants instead of developing new drugs. That might shift their focus. And economically, guys, let's not forget, it could go either way. Because on one hand, the US jobs in pharma might increase according to what the government wants. But on the other hand, businesses will pass this extra costs to the consumers. Hospitals, patients, insurers, everybody will feel the squeeze. And if these countries retaliate, right, it will go into a trade conflict. And this will be more than just the medication. And the list goes on and on and on. Because this policy, guys, I don't know what you think, it has dramatic, complex consequences. Because it's not just about production, it's about money, supply chains, international policies, international politics, everything all tangled together into one. Guys, the ripple effect just goes on and on and on. Let me know your thoughts in the comments. Let's see what these other creators have.
Trump has put 100% tariff on pharmaceuticals that are not US based, which is pretty much like almost 80 to 90% of the pharmaceutical market. Most of the drugs and most of the prescriptions that people get from their doctors are not US based. They are from overseas. This is going to have a terrible effect on the market and how people pay and receive their medicine. Because this medicine will not be readily available because of the tariffs, they will not be shipping it over to the US. What's going to happen is most of these people that receive this medicine are going to get substitutions. The problem is these companies that make this medicine are not prepared for the 100% tariff that Donald Trump put on, because now they have to mass produce these substitutions and they don't have the product and they don't have the money to do it, which means that medicine that's normally at a cheaper rate will be more expensive than the actual medicine that's coming from overseas. And that means that if you don't have insurance, you're paying top dollar for the medicine. And then if you do have insurance or if you do have a copay, your percentage of that copay is going to raise dramatically, probably 80-90%. The rate of minimum wage and with the way that people can't even get jobs, they're not going to be able to afford medicine. This is going to displace a lot of people, and a lot of people that depend on their medicine monthly, and they depend on their copays and they depend on their insurance to get this medicine that's already not going to be available, and now it's at a fucking more expensive price. A lot of people are going to end up in the hospital, and I'm not even going to lie, a lot of people might not even be here anymore after this, and it's going to start in October.
I don't take any medication, so I don't get why I should have to care about the 100% tariff that's being tacked onto pharmaceuticals. It's not like it's going to impact me. I have started seeing a lot of these comments on the internet as we are raising the concern about Donald Trump tacking on a 100% tariff onto pharmaceuticals. One, you should have basic empathy for those that are going to be directly impacted by their medication becoming extremely expensive. That puts a lot of people at risk when it comes to not receiving medication. Bottom level, we should care about our neighbors and their access to healthcare. Second, if you do not think that you're going to be impacted by a 100% tariff on pharmaceuticals, then you need to check again. If we have to start paying more for drugs through our insurance companies, then our insurance companies are going to start raising how much your insurance costs, even if you do not have to pay for drugs. Plus, while they're making it more expensive, they'll most likely take down some of your coverage and you not get as much coverage as you currently do. Something like this impacts all of us and not just one person.
Trump just announced 100% tariff on pharmaceuticals. And if you think that your meds are expensive now, well, buckle up. Here's what this means. A tariff is basically a tax on imports. Pharma companies that manufacture abroad will either stop shipping to the US or just pass the costs on to you. Well, that means higher prices for a wide scope of drugs, you name it. Big companies like Roche or Novartis are bragging they won't get hit because they've got US plans. But what about the smaller ones? What about niche drugs with no US production? Those patients are going to get squeezed hard. And remember, building a new pharmaceutical plant isn't like building a Walmart. It takes years, billions of dollars, and strict FDA approvals. So do not believe the fairy tale that this will suddenly bring drug prices down. In the short term, it's almost guaranteed to make them much worse. This is political theater dressed up as economic policy, and the people having to pay the price are patients. So next time you hear tariffs will save American jobs, ask yourself, who's paying the bill? Spoiler alert, it's you.
I'm trying to look at this from two perspectives because this can and might actually shape the pharmaceutical industry in the United States. Some companies might financially, invest heavily in American manufacturing, and this might be good for, local economics, national security, and more factories in the United States can, probably make supply chains more resilient, especially if there is global crisis. But I'm looking at the challenges here. Building the state-of-the-art plants are so expensive and skilled workers are needed. And y'all know what happened the other time about skilled workers, right? And even with the factories here, some of these raw materials might still come from abroad, meaning the US cannot fully be independent overnight. And for consumers, if this plan should work, drug availability, might improve in the long run, but there are short-term risk. There's risk of higher prices and there's risk of shortages, and you don't want medication to be shortaged. And those that might exit the market at the long run if they cannot afford US facilities. This just looks like a lot, guys. It looks like a gamble. And on the other hand, it looks like a game changer for American pharmaceuticals. Or is it a headache without delivering promised results? Guys, I need to know your thoughts in the comments, because my take from this is that this 100% pharmaceutical tariff, it looks bold, it looks dramatic, it looks messy, okay? And the end result is looking like it might, be good for US manufacturing, strengthen supply chains. And the other part is that only time will tell who this is going to hurt. And I just hope that at the end of the day, it is not too late, because the consumers will definitely suffer from it. People that rely heavily on their medications to be alive. I need to know what you guys think about this in the comment section, because it looks like we just go and come and there is a new thing on the chopping block. Let me know what you think about this in the comment section, and I'll see you in my next video. Please stay safe. Mental health is important. Don't forget to like, share, and subscribe. Ciao.